Hi everybody. My presentation, my vulnerable population is the LGBTQ community and their environmental and cultural factors that affect their health outcomes. So starting off just talking about the different health concerns that this population has. So there's a few big ones. Sexually transmitted diseases are a big issue for this population in that they are at a higher rate than others to have sexually transmitted diseases. Also, some cancers can be more likely in LGBTQ people. They can have higher rates of mental health issues, increased risk of suicidal behaviors, and just an increased risk of a higher risk of behaviors overall. So the media's effect on the health of LGBTQ and their community. So historically, the media has portrayed the LGBTQ community with just kind of exaggerated stereotypes. You see a certain persona that they assume is all LGBTQ people, and a lot of the time this does include heightened promiscuity. So seeing these repetitive stereotypes through the years can lead people to think that LGBTQ people are more promiscuous than the general population, and that can lead to some barriers for healthcare, thinking that things are their fault or assuming things about them that aren't true. LGBTQ people have also been historically underrepresented in the media. It's getting better over time, but also just having a population that you don't ever see, that can lead to some healthcare issues because people are less aware of them and their needs if they're not represented in the media the same as everyone else. So peer and family influence are huge with this population. Family support can make or break their outcomes. An accepting and supportive family, it's associated with greater self-esteem, more social support, better health status, less depression, less substance abuse, and less suicidal ideation behaviors. So that's a really huge deal. Having the support of your family can make such a big deal for these people. Just also a note that we do want to talk about if this is a cyclical issue, but that doesn't apply to this population, as sexual orientation and gender identity are not genetically inherited or passed down. Peers are also a huge influence for this population. A study that was a good example of this looked at high school students who have been victimized by their peers or bullied, and those students had higher rates of truancy, lower grades, and lower intentions to finish high school or go on to college. And that just kind of applies throughout the lifetime. LGBTQ people are a lot more likely to be victimized and bullied by their peers, and that can really affect all their health outcomes, their life outcomes, their mental health especially. So the legal and political system in the United States has been kind of up and down through the years for the LGBTQ population. It's come a long way as far as there are a lot more rights for these people now than there were before, but it continues to fluctuate with just changes in government and different people in office and continually changing laws and bills and policies. One of the biggest historical issues that this population faced was same-sex marriage being outlawed for a very long time and then varying state to state, though recently the federal government did legalize same-sex marriage. Other issues that come up and kind of fluctuate affecting same-sex people's health outcomes include transgender people being able to serve in the military, being able to use public bathrooms, and then just discrimination in healthcare. A lot of lawsuits come in that situation. So they kind of play out differently state to state based on the culture there. And so honestly, the legal and political system, it's kind of an ongoing issue and just a lot of up and down for the LGBTQ people. So some potential barriers, some social determinants of health that could affect these LGBTQ people, availability of resources, kind of depending where they're at or what resources they have, that can affect their health. If they have access to education, economic and job opportunities, which sometimes it might be different for them based on discrimination or the opportunities they've found. Their access to healthcare service, sometimes they have kind of specific needs and just general health care is not adequate. And then just community-based resources. Depending on what community you live in, there may or may not be resources for an LGBTQ person. Social support definitely varies based on the setting you're in and the people you find yourself surrounded by. And if you don't have that social support, it can be a huge barrier. And then just social norms and attitudes, kind of the same as the social support, but having that huge determinant that can affect mental health and overall health as well. So internationally, there are a lot of countries who have moved toward more inclusive laws for LGBTQ people. There's still at least 80 countries that have laws against sodomy, so same-sex relations are just completely illegal, and the punishment can be anything from like a physical punishment to the death penalty. Just some examples, in Nigeria, same-sex relationships are criminalized, and then also just friends, family, and colleagues who stand up for these people, they're also criminalized. In Uganda, there was recently a bill that would sentence people from 3 to even 7 years imprisonment for even assisting LGBTQ people. Russia recently was debating a bill that was basically, the way they worded it was any expression of same-sex orientation where children could see it was illegal, and it was a roundabout way of making it so LGBTQ people couldn't have any public events or express any public opinions. In Honduras and Mexico have a lot of situations of just hate crimes and violent attacks on these people, even though it's not laws that are against them. It's just the culture is very violent, including even stories of police officers torturing them. And then Saudi Arabia also has instances of sentencing people to the death penalty. Socioeconomic status does affect this population a lot. The LGBTQ people have just been shown to be more susceptible to disadvantages. Same-sex couples are more vulnerable to poverty than heterosexual couples. They're more likely to be needing cash assistance and food stamps. A higher percentage of gay and lesbian men and women live in poverty when you compare them to their heterosexual counterparts in the same demographics. And then transgender adults, they're 4 times as likely to be in a household that makes less than $10,000 a year than just the general population. So a lot of issues for this population in the socioeconomic topic. As far as race, ethnicity, religion, and gender, these are obviously quite variable in individual circumstances, but when it comes down to it, people who are in racial and ethnic minorities and also LGBTQ, they face everything that people who are racial majorities face, and times that by a lot more, because they are facing discriminations for their race or their ethnicity, as well as discrimination for their gender identity or their sexual orientation. And it just doubles, triples, adds to their being afraid to go to get healthcare, not having healthcare available to them, facing discrimination in healthcare settings. So it just compounds along with the discrimination they're already facing. Religions, there are a lot of mainstream religions that still condemn to some degree or do not support the LGBTQ community. So just with how common a lot of those religions are, that adds extra barriers for these people. May lead them to avoid feeling comfortable coming out, may lead them to getting not enough care that's adequate for them, and it's just one extra layer of discrimination and discomfort for these people to come out and get the help they need. And then gender is obviously kind of encompasses all of the issues of this population, but there's ongoing issues with trying to fit in with gender norms and expectations and finding themselves not traditional in that way. They face a lot of barriers. Geographic location. Rural health is always more difficult regardless of sexual orientation and identity, but especially the percentages of LGBTQ people are considerably lower when you get into rural areas as opposed to the more urban centers. And so not only is there just an overall less access to healthcare in those rural areas, but then especially you're not going to be able to find resources that are more specialized to the LGBTQ community. So they may not feel comfortable, they may have less resources, and telehealth would really be helpful in this scenario if they wanted to talk to people more specialized for LGBTQ, and just to link up with doctors who are more familiar with their scenario if you live in a more rural area. Biases. This is a huge issue for all vulnerable populations, but definitely especially for the LGBTQ people. Implicit and explicit. There are plenty of LGBTQ people who hold implicit biases, and even they themselves feel uncomfortable with their sexual orientation, and they have a hard time being out and open about their sexual practice so that they can be as cautious as they need to be and be treated like they need to be. But they meet so many biases, everything from people assuming they're more promiscuous, like we talked about before. There are trans people make a lot of assumptions that their gender identity is just a choice and they could just switch if they wanted to. People make assumptions about their family, whether or not they want to have their own families or if they can. All these things just build up to people in the LGBTQ community not feeling that they can get equal health care, not feeling like they can be honest in healthcare settings, and not really feeling like they fit into the system. So these biases are kind of built in all along the way, whether they're just expressed or just built into the system. Things like forms not having a bubble they can fill out for their gender expression. So biases are a huge issue, and as soon as we start realizing them and finding where those implicit and explicit biases are in the healthcare system, the sooner we can correct them and get more adequate coverage for these people.